Okay, well, as I promised all of our presenters tonight, I would not start later than 2 minutes after the hour. So I am going to begin and kick us off. Welcome to our event tonight, everyone. This is the Healthy Vote, taking action to protect education, long-term care, and our climate. Washington Physicians for Social Responsibility is so glad to welcome you all here tonight. My name is Max Savashinsky. I am WPSR's Executive Director, and I want to tell you just a little bit about our organization and our moderator tonight. WPSR works to create a healthy, just, peaceful, and sustainable world by taking on the gravest current threats to human health and survival. Tonight, we're here to discuss how you can all take action to prevent those threats from harming the health of Washingtonians. We can't understate how important these issues are, and this November, you will all have a chance on your ballots to ensure that we organize and protect the core tenets of a healthy, just, peaceful, and sustainable world. I, on behalf of Washington Physicians for Social Responsibility, want to offer a special thank you to all of our members, physicians, other health professionals, and volunteers for your support of our work. If any of you participating in this event tonight want to join WPSR in our efforts, we invite you to sign up to become a member at WPSR.org. All are welcome, and we encourage you to join our email lists for climate change and economic inequity, which you can find at WPSR.org/climate/inequity. Before we move on further, we want to take a brief moment to acknowledge that we are all joining you from the traditional and unceded ancestral lands of the first people of Seattle, the Duwamish, past and present. We aim to honor and bring light to their heritage and hope that you will all join us in doing so. I now have the great pleasure of introducing our moderator for tonight, Dr. Raj Sundar. Dr. Sundar is a dedicated, passionate organizer who dedicates his time to advancing healthcare equity through community organizing by leading the over 700 members of the Kaiser Health Equity Action Team. In his spare time, he is also a family medicine physician. He's a networker, a builder of change who amplifies voices of the unheard, and we are grateful to have him as a WPSR member and with us tonight to lead us through our event. Dr. Sundar, please take it away, and thank you for being here.
Thanks for that introduction, Max. I'm always at awe when I get the introduction, although I send it, so I got to be careful of what I say about myself. But I really appreciate setting me up in that way because I really do believe in organizing, especially in topics like this, so we communicate and work together to make the change that we want. I would love to set the stage for our conversation today. There's a reason that I'm the moderator, specifically because some of these initiatives, the way they're talked about or the way you've heard about it, may not feel like it's related to health. But I want to be clear, we're going to explore 3 ballot initiatives that could significantly impact health outcomes in Washington state. I want to emphasize that phrase, health outcomes, because it's at the heart of what we'll highlight and what we work to do as a group at WPSR. I was thinking about this as a family physician. I see patients daily in like 15 to 20-minute slots. The craziness that anybody who's practiced medicine knows. And if you're a patient, you've been in that craziness too. That feeling of urgency, the rush, the blur. And I do acknowledge, and I've had this in that setting, there are beautiful moments of healing. It does happen. And in the last 6 months, I was thinking about what has made me feel good doing this job and what have I seen. And here was a list of things that I was happy about. A mother's depression improving with medication and therapy, a child's asthma finally under control and not having to go to the ER every month, a caregiver's diabetes well managed with the right insulin dose. These are all successes. It's like, wow, like we did it. Healthcare system, doctors, our team members working together. But in all these cases, they really were masking deeper issues. And some would say, quote unquote, the real issues that we seldom address in healthcare clinical encounters that I don't get a chance to address. And that is what we're going to talk about today because we need to address some of the symptoms of larger systemic problems that's contributing to poorer health. Michael Mermott, the pioneer in public health, called these the cause of causes. So what does that mean? Let me clarify. With all these examples that I just said, that mother whose depression improved over a year, was a single mother, exhausted and depressed, was struggling, often had to take her child to work to make ends meet. And she was trying to juggle all this because one of the major contributors to her mental health was lack of access to affordable childcare. She just didn't have much support and was doing the best she could. That child with asthma that finally got it under control, we were celebrating, but the major contributor to her asthma was that it was wildfire season because the rest of the year actually didn't hear much about it at all. But then wildfire season started, the smoke, and she was having exacerbations all the time that she needed multiple inhalers to make sure she could breathe. In that patient with improved diabetes, it was a son neglecting his own health while caring for his mother with Alzheimer's dementia. He was too tired to take care of himself. The major contributor to this was not he was not adherent to his medication, but there's lack of long-term care support for his mother. So in all these instances, if you dig deeper, there's actually a root cause. And the root causes are lack of childcare, climate change, and inadequate long-term care support, which is Initiative 2109, Capital Gains Tax and Education Funding, Initiative 2117, the Climate Commitment Act, Initiative 2124, regarding the Washington Cares long-term care program. This is what health policy experts call the political determinants of health because this is how power, resources, and policy are structured and ultimately actually shape the health outcomes that we care about. The cause of causes that I mentioned. So here in Washington, it's also worth calling out because everybody knows, but let's say it out loud. These initiatives are part of a significant effort by a single donor, Brian Haywood, who has contributed nearly $6 million to place these and other initiatives on the ballot. That's an important context to have because the question underlying all of this is this the kind of democracy we intend to build together? Our panelists tonight are going to bring expertise from diverse places to help understand these complex issues and make sure that we all take the healthy vote seriously with these initiatives. We're going to hear from the panelists, but a lot of this, especially events like this, I find most productive and fruitful if we have lots of questions because we have the experts in the room. So if we know what you are thinking, we can address those directly. So please use the Q&A function to submit your questions. There's an upvote feature on there, I believe, as well. So if you have a question that you really want to hear, even if it's not yours, upvote that question, and we'll get to that at the end of the talk today. Let's begin by introducing our panelists. First up is Christina Keys. She's going to be talking about the I-2124, Washington Cares. She's a dynamic caregiver, collective visionary, and master community builder. I love all of those terms. Her work has been featured on national TV, radio, Netflix, NPR, you name it, and has been in publications like Washington Post and Fortune magazine. She's a change agent and an individual who has devoted her time and effort to provide care for others. She is going to tell you about her story and why she has chosen to advocate for caregivers nationwide and why we all must support long-term medical care in Washington. I'm thrilled to introduce Christina Keys from We Care for Washington Cares Coalition. Christina, we're so excited to hear from you. Go ahead and
Thank
take the
you
mic.
so much, Raj. I'm excited to be here tonight. Perfect. If you can go ahead and load that from the beginning there. All right. Well, my name is Christina Keys. If you can go ahead to the next slide. And I cared for my mother, Patricia Keys, after she had a massive stroke. And if you can go to the next slide there. 12 years ago, I was in the prime of my career with a great job in tech, and my mother had a life-changing stroke. She was 62 years old. She had just retired from her career in aerospace at Boeing and was an active, healthy person. She had literally just got done laying hardwood floor in her home the week before. She had fallen, passed out, and hit her head on the side of the couch and had a paralyzing stroke. We spent 3 months at Harborview Hospital, where mom got excellent care from the doctors and nurses there. But when I walked in those doors, I was a career woman. And when I walked out those doors, I was an unpaid family caregiver with a rude awakening that both of our lives had changed forever. I had no choice but to leave my own career that I had worked so hard to build to care for my mother. Like most people, we had no other options. We were shocked that mom's health insurance would not pay for most of her needs. It wouldn't pay for home care aids, home modifications, like the things we needed for her to take a shower, wheelchair ramps, equipments like a hospital bed. We were also disappointed to learn that Medicare pays for very little and only covers one piece of medical equipment every 5 years. I had a mother who was paralyzed on one side with multiple medical complications who needed more than one piece of medical equipment. I did all the hard things no one wants to imagine doing for their parents, helping them use the toilet, changing their adult briefs, lifting her from bed to wheelchair, feeding her, bathing her, and so much more. I instantly became a CNA, a med manager, all the things that she needed, a physical therapist, occupational therapist without any training. I'm grateful to care for the care journey for my mother, but it was really hard. It was incredibly rewarding to spend so much time with her, as difficult as it was to see her so helpless. I learned so much about how deeply our society and our systems ignore and deny the reality. If we live long enough, we're going to be the one who either needs care or one who becomes a caregiver. In fact, more than 820,000 Washingtonians are currently unpaid family caregivers for a loved one. Why? Because their loved ones do not have long-term care insurance, and most families has less than $5,000 in savings. The vast majority of caregivers are women like me who've had to leave their jobs or significantly cut back on their hours to care for a parent or in-law or spouse who is sick or injured or aging. I-2124 makes things even worse by killing Washington's long-term care insurance program for 3.9 million Washingtonians. It'll put millions of women like myself in the same position of choosing between their loved ones, their jobs, and the family's finances. It'll drive more people into debt and lose income, and they have to tap into their savings to cover our loved ones' expenses. I've been there. We can't afford I-2124, which would make an already costly, heartbreaking journey even harder for millions of Washingtonians. If you can go to the next slide. On July 15th, we had a campaign launch, and I'd like to share a quick video with some of the highlights. I was 44 years old with a good job in the tech industry when my mom suffered a stroke at 62, and everything changed. I had to leave my job to care for her. After just a year and a half, we had gone through a lot of our savings, and pretty soon there was nothing left. So I took 5 part-time jobs. We had a lot of garage sales, and I even had to sell my own plasma. I'm voting no on Initiative 2124 because I don't want one more woman in Washington to go through what I've gone through. Washington created its long-term care insurance program to help provide care to nearly 4 million working Washingtonians, from teachers and nurses to firefighters, and everyone in between. I-2124 would gut that program, which is why we must vote no. Because my story, it may sound unthinkable, but it's not uncommon. More than 800,000 Washingtonians are currently working as unpaid family caregivers, and most of those are women, many of whom are forced to choose between a promising career and their promises to loved ones. Washington's long-term care insurance program can help, but only if we come together to protect it. Take it from me, we cannot afford I-2124, which would make an already costly, heartbreaking journey even harder for millions of Washingtonians. Next slide. Awesome, thank you so much. So the takeaways from today would be, if we take away long-term care funds from 3.9 million hardworking Washingtonians, when we can help due to their serious illness, disabilities, or impact of aging. It hurts women who most likely have to leave their jobs or cut their hours due to caregiving. Women are also discriminated against by big insurance companies, which charges them higher premiums. Next slide. It increases our costs and family debt by taking away critical benefits. Low and middle income people are least able to afford private long-term care insurance or to pay out-of-pocket care. It throws us back into expensive long-term care private insurance markets, which jacks up premiums 50, 100%, or even 300% without warning, delays, denies claims, and does not cover those with pre-existing conditions. And one of the things that I want to point out is anybody who's been a caregiver, even if they're very healthy, at the beginning of their care journey, things like depression and other health issues come up. And so they gain pre-existing conditions all of a sudden, and they're denied their long-term care insurance. Next slide. These are some of our endorsers for no on I-2124. Next slide. And if you'd like to join the over 175 doctors and healthcare providers that have endorsed no on I-2124, we'd love to have your support. You can simply go to no on 2124.org/medical endorsers. Next slide. And if you have questions after today's presentation, you can simply go to our website at noon2124.org or email Libby at noon2124.org or myself at Christina@ChristinaKeys.com. Thank you so much.
Thank you so much, Christina, for sharing your story and about your mom too. So personal, and I totally understand how this has transformed your beliefs. And want to be abundantly clear, at WPSR, we oppose the initiative 2124, which makes Washington Cares optional. I also want to make leeway. There's people from different places to remind folks that Washington Cares is a state-run long-term care program funded by a 0.58% payroll tax on workers. It's supposed to provide up to $36,500 in lifetime benefits for long-term care needs. And it's set to be available in July 2026. It's a big program to help people like Christina's family. So again, Christina, thanks for sharing that very personal story in this setting for us. The next initiative that we're going to talk about is the initiative, 2117. And we're going to talk about the initiative because just as I talked about the previous initiative, I think it's helpful to set the context. And I know Mark will talk more about it too. But Initiative 2117 aims to repeal the Climate Commitment Act, which was passed in 2021. It established a cap and invest program to reduce greenhouse gas emissions in Washington. It started in 2023 and has generated over 2 billion climate-related projects from my research. And its set emissions reduction targets 45% below 1990 levels by 2030, 70% by 2040, and 95% by 2050. So this is an initiative to reduce the effect of climate change for our communities and for our state. Thank you for being patient here while I juggle a few things as I'm having tech issues here. So we're going to have Mark Prentice talk about this. He's the founder and president of Union Street Strategies. His delivered strategies to serve and elect the Seattle mayors, leading members of the House Representatives and U.S. Senate, advised the late Paul Allen, and now is working to ensure Washington's environment is healthy for years to come. I love this line. I don't know who wrote this. With campaign experience almost old enough to vote itself, I would like to introduce Mark Prentice, the communications director for No on I-2117 campaign.
Thank you, Dr. Sundar, and thank you all for having me. I really appreciate it, and I'm totally deserved to feel a little dated here on my years on the campaign trail, but I'm really excited to be speaking with you all tonight, and just so appreciate you all taking the time out of your busy professional and personal lives to engage in learning about how important it is to vote no on all three of these initiatives that we're talking about tonight. So really appreciate the chance to be here. So on behalf of our whole team, thank you. I am just going to share my screen, and please bear with me if I am having any tech issues. Please tell me. So hopefully everyone see that okay. Let's see. Oh, okay. My computer just froze, but people still are with me? I'm so sorry. It's not allowing me to some reason to share my screen. So would it be okay? Well, I sort this out. Maybe would it be okay if we skipped ahead? What would make the most sense? I want to be conscious of everyone's time.
We can move on to treasure, and then we can come back to you. Does that sound good?
Yeah, that sounds great. Thanks for
Yep.
bearing with me.
All right, everyone. Thank you for being patient as we work through the webinar in Zoom. We want it to be as smooth as possible as we are trying this out with WPSR. We're going to go to treasure next, which is about Initiative 2109. Quick context, people know 2109 aims to repeal Washington's 7% capital gains tax, which was enacted in 2021. It applies to capital gains over $250,000 annually from sale of assets like stocks and bonds. I mean, calling that out, it's from stocks and bonds over $250,000, so it's actually a small group of people. And the first year collected nearly $900 million, exceeding projections. Think about this in the context of one of the most regressive tax systems in the country at Washington State, and how much that affects things like education and so many other state-funded projects to improve the health of our population. I'm excited in this context to introduce Treasurer Mackley. Her leadership has taken her to Hawaii, Indiana, and Kentucky. She's served as a vice president and political and organizing director at Planned Parenthood Votes Northwest. And with a nearly decade of dedicating hers to ensuring those who need it most are protected, she joins us today as the executive director of Invest in Washington Now, where she guides educators, working families, and Washingtonians to build a Washington that works for all of us and is going to flip our upside down tax code. We're so lucky to have you, Treasurer. Thanks for talking about this.
Thank you. It is so wonderful to be with you all tonight. And I just want to appreciate the technical difficulties. It is usually me that is the one struggling with technology. So, Mark, I feel lucky to be able to share this experience with you. But let's dig in and talk a little bit about Initiative 2109. So, as mentioned, my name's Treasurer Mackley. I'm the executive director with Invest in Washington Now. We are a statewide advocacy organization that has been fighting for a fairer tax code here in Washington State for the last 4 years. But tonight, I'm here to talk to you specifically about Initiative 2109, which is a measure that would repeal the capital gains tax and take away billions of dollars in funding from education, school construction, early learning, and child care. So to start, I'd like to ground us in what the capital gains tax is and why it's so important to Washington families. So as you heard a moment ago, the capital gains tax is a modest 7% tax on the windfall profits from the sales of stocks and bonds. So if you sell stocks and bonds and you make a profit of $250,000 or more, you would pay a 7% tax just on the amount over $250,000. What that means is only about 0.2% of Washingtonians pay tax, and these are the very wealthiest people in our state. Now, this legislation was well over a decade in the making, and it was drafted with the intent of starting to fix our upside down tax code here in Washington State. As a result of this, and as a result of the multiple conversations that went into crafting this legislation, there were many exemptions that were written into the law to make sure that low and middle income earners, everyday Washingtonians, wouldn't pay this tax. Let's go to the next slide. All right, so this has a little bit about that. So some of the things that are exempted from the capital gains tax are residential real estate, retirement accounts, farmland, timber, livestock, the sale of small businesses, and other assets are all exempt. So the only folks that pay this tax are people who sell stocks and bonds and make a profit of over $250,000. Now in 2023, which was the first year that we were collecting this tax here in Washington state, only 4,000 Washingtonian taxpayers ended up paying this tax, and most of them were extremely wealthy folks in King County. Let's go to the next slide. So as we can see, out of the folks that paid, the 4,000 folks that paid the tax in 2023, 84% of those folks lived in King County, 16% were in the rest of Washingtonian. But as mentioned earlier, this tax raised that year of $889 million. So a very small percentage of folks in King County mainly paid this tax, but the benefits were felt in every single corner of the state. Now, the capital gains tax was an important step in fixing our upside down tax code. For decades, Washington has been ranked dead last in tax fairness. Here in Washington state, low and middle income earners often pay a higher percentage of their income in state and local taxes, often up to 17%. And then we see the wealthy, the folks at the very top of the scale, are paying 3% or less. So with the passage of the capital gain tax and the working family tax credit that were both passed together, we were able to make our tax code more fair and more just for the first time in decades. And that meant that here in Washington state, we finally moved out of last place in terms of having a regressive tax code. We used to be number 50, now we're number 49. And we've started to make that progress when we ask the richest people in our state to pay what they truly owe in taxes, just like the rest of us have been doing all along. So let's move to the next slide. So talking specifically about Initiative 2109, this is the initiative that's the effort that would repeal this tax. And as you've heard, this initiative is one of the pet projects of Brian Haywood, who is a multimillionaire hedge fund manager from California. The Seattle Times recently called him Tim Eyman with a gigantic bank account. And he did spend over $6 million of his money to qualify this initiative and others. And he would most likely benefit from the repeal of the capital gains tax and probably would give himself a tax break. So when we think about what's at stake with Initiative 2109, I think we can go to the next slide. Let's see. Oh, let's go back. I'm skipping ahead. That's all right. All right, so when we think about what's at stake with Initiative 2109, Initiative 2109 will give a tax cut to the wealthiest Washingtonians and leave the rest of us to foot the bill. If passed, Initiative 2109 will take away over $2.2 billion over the next 5 years from education, school construction, early learning, and childcare. Now, in 2023, the capital gains tax brought in $889 million, and that was funds that went directly to provide for childcare, early learning, and K-12 public education. This helped families from every corner of the state, whether it's helping to pay for childcare or to be able to access childcare, public schools getting more resources, and we've finally been able to invest and pay for some much needed school construction projects and repairs. Now, if it's repealed and Initiative 2109 is repealed, we'll lose that $2.2 billion over the next 5 years. And the wealthiest Washingtonians in the state will get a tax break, while the rest of us will be left with the bill. So I think, as you all know, schools are already facing budget shortfalls, and we already struggle here in Washington state to fully fund education. Just like families are already struggling to access childcare and early learning. In so many communities across the state, not only is it a challenge to be able to find and access quality childcare, but many families struggle to be able to afford it. Initiative 2109, if it's passed, will just make that worse and exacerbate the problem. Bottom line is, it'll take $2.2 million away from education, childcare, and early learning, and give a tax break to less than 1% of the wealthiest Washingtonians. So the choice really couldn't be clearer when it comes to Initiative 2109. That's one of the reasons why we're asking folks to vote no on this initiative. Now, the good news is, and this is where we can go to the next slide, The good news is that when voters hear about this initiative and they understand what it funds, and especially when they hear the exemptions and realize that, like, if they sell their house, that's exempt, it's not going to apply, their retirement accounts are exempt, all of those things. When they see this, they are with us. In fact, we've been seeing this over and over and again over the last 4 years as we've been out talking to folks in every corner of the state and doing polling, that we're really seeing that there's been a shift in public opinion over the last 14 years here in Washington state, where folks are really starting to understand that our tax system here in Washington state is upside down, and that low and middle income folks are paying far more than those at the very top. And they're also starting to recognize with that initiatives like 2109 are not the right way to go. And in fact, we've been seeing that a majority of Washingtonians, 62% of Washingtonians, are opposed to Initiative 2109 because they see it for what it is: a tax break for mega millionaires that will take billions of dollars away from our kids and our schools. Now, we all know that for kids and families to thrive, and you all know this most especially because of the work that you do, not only do they need good schools and families need access to quality childcare, but kids also need the ability to learn in buildings that are safe, where they can fill up their water bottles, breathe clean air. And as healthcare providers, you understand this and you see this every single day. And that's one of the reasons we are hoping that you'll join us in voting no on Initiative 2109. We've got a couple ways that we'd love to ask you to support the campaign. Of course, we'd love you to just vote no on Initiative 2109, but also, be able to help support the campaign by donating support. We know that in order to win, we've got to be able to communicate with voters all across the state. We also have a sign-on letter for healthcare providers. We're building support across industries, and we can go to the next slide here. We are building support across industries. We have over 130 organizations who are already engaged in supporting the No on 2109 campaign. We'd love to be able to add your names and voices to the mix. And then, of course, as we move into the fall and we're out talking to voters and the campaign is heating up, we'll need folks to volunteer, whether it's writing a letter to the editor, knocking on doors, or sharing your story about why it's important to you. Folks like you all are critical voices that can really make a difference in making sure that we defeat Initiative 2109 and we do what we can to protect our kids and our families and everything that's important to us. I'll pause there. Thank you.
Thanks, Treasurer. As with all the other presentations, feel free to put the Q&A or any questions you have in the Q&A, and we will get to them after all the presenters. Treasurer, you talking about all that helped, I think, emphasize the fact that it's not just a capital gains tax, but what we're getting from it. It's in the context of in Seattle, the Seattle Public Schools closing 20 elementary schools due to a budget shortfall. And me coming from North Carolina to an interesting place where there's no income tax. So there's no money for education in a state like Washington State, which we call ourselves progressive, but don't have the resources to do what we need to. So helping connect that dot and understanding who it really affects. So thanks for explaining that. Mark, are you feeling you've wrestled your computer down and the Zoom is cooperating with you to take it on?
I'm feeling pretty confident. Thank you again. And one of the things I love about working on campaigns is you get a chance to really fight and for the things that you believe in and your values. I also learn something new every time of many things. And tonight I learned that sharing Zoom with like a secondary monitor doesn't work well. So I think I have resolved that problem. So let's see how we do here. Okay, I'm feeling better about this already. Everyone see that okay? Great. So I really like to start here to sort of ground this discussion and what this fight is going to be about. And this is going to be a tough fight, but this fight is really about our clean air. It's about our land, it's about clean water, and it's about health. And so at its core, a vote no on 2117 is a vote against more pollution, and I will talk about why a little bit more. But I like to start here. Okay. So another sort of to set the scene here as far as what is at stake. So 2117 would mean more pollution, and it would mean some very serious cuts to public investments across our state in health and air quality, in water, in forest health, in transportation. We'll talk more about that, but I'd like to just share this as to sort of show that this is going to impact every corner of our state. The cuts and the harm that 2117 would bring. And we talked a little bit, Dr. Sundar, thank you for setting this up much better than I would, of what 2117 really is. But at its core, it ends public investment in core priorities, community priorities, and it does that by repealing the Climate Commitment Act. And I think it's also important to just note, in addition to the harm that 2117 would do to our state and our communities and our families, it also would send a very chilling signal around the country, to other governors, to other legislatures, about what is possible when it comes to establishing policy that protects health and communities. So our campaign, we are just so incredibly grateful to have a truly growing, unprecedented statewide coalition. As of today, we are over 350 organizations, which we are just so grateful for all the support, including from the wonderful organization hosting us here tonight and bringing us together. I'm definitely not going to go through the list, but just sort of categories. There are, along with health and medical organizations, there are firefighting and fire prevention organizations because of the impacts on wildfire prevention programs, many tribal nations, small businesses, some of our state's largest companies, over 20 labor unions, environmental groups, community environmental groups, community organizations, and on down the list. We're also very grateful to have over 800 active, hardworking, amazing volunteers in 24 counties as of tonight. As we were sitting here while I was sorting out my tech issues, I got a text that we have a team of volunteers down at Green Lake in Seattle tonight, with the table, talking to people as they're out enjoying their evening walk. So we are growing all these numbers, and this is the kind of coalition and grassroots energy it's going to take to defeat this initiative. So what just a quick sort of, where are we in the campaign? Everything that we have seen shows that we do have a path to victory. This is a winnable race, but this is going to be a tough fight. Voters can be persuaded on this in both directions, and we will talk more in a minute, but our opposition has a very misleading message, but it does have power behind it. We talked about our friend, Mr. Haywood, here already, so I won't spend too much time on this, but unfortunately, along with other priorities here in our state, he has invested heavily in undoing a lot of the progress we've made here in our state. So our path to victory, really, as a no campaign, and what, from everything we've learned, we are really focused. Our goal is to really sound the alarm about the harm that 2117 is going to bring, and we really try to keep this out of a partisan frame, and really talk to people about. We're going to be talking to voters about the impacts that this is going to have on their family, on their family's health, on their communities. So again, as the No campaign, we are warning our fellow Washingtonians about the damage that 2117 would do. And there's a lot of it, and so I won't sort of go through everything, but I think for all of you, one thing I wanted to highlight is that when we have already so far talked to voters about the impacts of 2117, the health impacts really, really rise to the top of the harm of allowing more toxic air pollution. While we discussed wildfires briefly already, but 2117 would strip away huge amounts of investments in programs that help local communities prepare for wildfires, that make forests more resilient, even training for the next generation of our wildland firefighting workforce in the state. And you all know better than anyone as physicians and experts the impact that that's going to have on kids and seniors and people with pre-existing conditions in the state. Also going to have tremendous impacts on our drinking water sources, rivers, lakes, and streams, and our fish habitat around the state. And it is also going to blow an enormous hole in our transportation funding plan. Everything from safe routes to school to road and bridge projects, and it would make traffic worse around our state. So that's sort of one piece of how we think and talk about the initiative. Is it's gonna bring a lot of harm. And the other thing I wanted to highlight is we've also, talked to a lot of voters about who are the trusted messengers on this issue, who they really will listen to, and health and physicians and public health officials and nurses really also rise to the top. So I'm just so, again, grateful to all of you for being here tonight, because your voice is so incredibly powerful in your communities and in your networks, and talking about not just the health impacts, but just the broad range of impacts of 2117. I talked about our coalition already, but this is also a really important sort of message in talking about this, the campaign, which is we, on the one side, you have Mr. Haywood and just to be really direct, his friends on Twitter who are really actively, Mr. Haywood has invested millions of dollars to undo a lot of the progress we've made. In contrast, you have this coalition, and I walked through that already, but just setting up that contrast is very valuable and important to know who is working hard every day to defeat 2117. It's also really important to highlight how misleading this initiative is and how intentionally misleading it is. They talk a lot about their promise to lower costs, but the truth is that they're not going to do anything to lower costs for families and workers. And unfortunately, the reality is that what they are proposing is going to lead to some very costly consequences. So they are misleading the public, and as a campaign and as a coalition, we think it's really important to really address that head on. And we want to spend a second on talking about gas prices. So one of our opposition sort of core messages, as misleading as it is vote yes, pay less. They make all kinds of claims about what is going to happen if 2117 passes, but the reality is that there's nothing in 2117 that's going to guarantee lower gas prices. If you read the initiative, as I unfortunately have had to do many times, which they wrote, they do not use the words initiative. And the truth, which they're, I think, very sensitive to, is if they were really serious about that claim, they would have put an effort around taking away our gas tax, which is a separate policy. And they chose not to do that. So certainly this is a message that, again, it's misleading but powerful. And it does it does come up. And so when you get questions, if you get questions about this, this is how we like to talk to communities and families about it. And just there's so many ways that you can help defeat 2117. Certainly, if you go to no2117.com, you can pledge to vote no. You can follow us on social media. You can sign up for our email updates. We also have options for volunteering. There's options for grassroots fundraising. Of course, we'd be grateful if you chose to invest in our campaign to defeat 2117. And again, just so critical, especially as such trusted messengers in your community, that anything that you can do to amplify our messaging and what we've just walked through across in your communities, across your network, would be so valuable. So I will end it there with, again, just incredibly grateful for your time tonight and for bearing with me on my tech issues as I learn more things during another campaign, and just thank you in advance for all that I know many of you will be doing to help us defeat 2117. So thank you.
Thank you so much, Mark. I learned a lot from your presentation and the importance of what we're trying to achieve here, and how voting no could help support the change we want to make, especially with the climate change that we're all feeling, with hotter summers, wildfires, air quality that I talked about. And it's a conversation that I'm part of a lot in even healthcare now. Like, how do we get prepared for something that seems inevitable? And Washington has passed something to make concrete change that this initiative is at risk at defunding and reversing too. So thank you, everybody. We did have some Q&A. We'll have about 20 minutes for question and answer. I was hoping to categorize in some way that made sense to me in some of the Q&A, some of the questions in Q&A, and some I had as I was thinking about what would be helpful for our audience members to take the next step. I was thinking about how it's important to have some form of hope in making this change and voting no. I'm saying that because one of our audience members said the Seattle Times had a July 23rd article reporting poll results that 2/3 wanted to support I-2109, including majorities Democrats. And if it was alarming to this audience member, it's like disinformation campaign is working. I heard from another person, it's like going to be really contested in all of these initiatives. So I'm curious for the whole group of what is the current state, the urgency of us campaigning with you all for this, and what can we hold on to as hope to make this change?
I'll kick us off on this one. I of course saw that poll as well, and a couple of things I just want to say about that poll, because it not only polled Initiative 2109, that actually polled all the initiatives. What it didn't do is actually use the ballot title language and the language that voters would see. The language it used was kind of nebulous concepts, so it didn't actually test what is going to be before ballots, or before voters on the ballot. The other thing that it didn't take into account is that in Washington State a few years ago, there's been a shift where any initiatives like these three initiatives that have that apply to anything related to taxes or revenues or fees will have what's called a public PID, public impact. I can't remember what the second I is, but disclosure statement. And what that does is it's a way of the Secretary of State's office, Attorney General's, it's an official statement that comes with the ballot title that says, for example, if 2109 is repealed, it will take funding away from education, school construction, early learning, and childcare. And it explains that to voters. So voters are actually going to be able to see both the ballot title and then the impacts. That Seattle Times poll didn't include any of that information. So it's kind of a nothing. The other thing I will say is that particularly with the capital gains, as we were working to pass this, and over, this piece of legislation from its inception to now has been 14 years. And over that 14 years, we have been talking to voters and we've been polling, and we have been consistently seeing that there is more and more and more support for initiatives like the capital gains initiative that fixes our upside down tax code. And when we test the actual language of the ballot and when folks see what's at stake, they're with us across the board. And it's not just Democrats, it's independents, it's Republicans, it's folks who understand that they've been doing more than their share when it comes to taxes for a long time, and feeling that, and they've been experiencing that. And they know how much we need to fund education. They know about funding childcare. And like, Christina, when she was sharing her story, it reminded me, I'm talking a lot about the Initiative 2109, but a few years ago, my dad passed away from dementia. And before he passed away from dementia, I was struggling to figure out how we were going to pay for that dementia care. At the same time, I had a kiddo who was 4 years old, and I was trying to figure out how to pay for childcare at the same time. These experiences are not uncommon. These are things that people experience in their everyday lives. And because of that, I feel that, as we can get out there, we can talk to voters, and I really do believe that Washingtonians will do the right thing and reject these initiatives.
Thank you, Treasurer, for that detailed and comprehensive answer. I do feel like that gives us hope. Any thoughts from Christina or Mark about that?
I just wanted to echo, I think Treasurer is exactly right. This specific poll, did not ask people about what they're actually going to be voting on. So that's sort of, as Treasurer said, that's the core problem. And just to sort of illustrate that, when you look at what are referred to as the crosstabs, which is sort of the demographic breakdown within the poll, like when they polled on Initiative 2117, for example, and in our case, it showed that young voters actually were more likely to vote yes than older voters, which is just from all the other data that we have, and just when you look at attitudes about climate pollution, about climate change, about environmental action, that's the opposite. So it's a really problematic approach. But I will say, just in our case, I think there's been other polling that's been done, and it does show that this is going to be a winnable but tough race, as I said earlier.
Yeah, and exactly what Treasurer and Mark said, I agree with them. So they said it all.
Thanks, everyone. There are a few more questions I categorized as, once we have hope, the next step is having confidence in voting no. And some of that is clarity on what we're voting for. Before the preparation for this, I had all the opposing points listed, and thankfully an audience sent one that was pretty common. And this question is for you, Christina, about I-2124, which makes Washington Cares optional, who said that the benefit is too small. So the 36,000 is not enough to help most people, and it's expensive, confusing. Really, we want to vote no because we need a different system overall. This is not the right system, and that being an opposing point of why people should support this initiative.
Well, I'm going to answer it as a caregiver and for the 820,000 caregivers in Washington. $36,000 would have been a game changer for me and my mother. $36,000 would have given us over 1,000 hours of care. $36,000 would have been able to let us get some of the equipment we needed to, the ramp we needed to. $36,000 would have been able to let me stay at my job longer. $36,000, many of those 820,000 caregivers that are in Washington do not have $36,000 ready to give to the loved one that they're caring for. They don't have $36,000 that in their savings that they can just take that time off work. And also those people they're caring for don't have that either. So is it enough money? Would it have paid for my whole care journey for my mother and myself? No. but what it would have done when we find out our loved one has dementia or our loved one has suddenly had a stroke. We need a minute to think. We need a minute to find resources. We need a minute to think clearly on how to spend the money we do have. Being able to tap into that $36,000 will give us a minute to breathe and maybe talk to some people who will help us plan longer than the $36,000 rather than having to just react right away. So is it enough? It's not going to cover everything, but it is absolutely needed for myself and the 820,000 family caregivers in Washington State.
Thank you, Christina. Well said. Well said. I was having the same thought, but obviously you have real lived experience of what it could have meant in caring for your mother. Thanks for sharing that. For the Climate Change Act, so Initiative 2117 to repeal the Climate Change Act, Mark, we had a question about examples of clean transportation funded by CCA on things that would disappear. So I know you talked about some big categories. Any specific things that maybe people are feeling that's directly connected to it, and specifically clean transportation that you could talk to?
Yeah, absolutely. Again, it's a great question. Unfortunately, there's no shortage of things that I-2117 would cut in our clean transportation progress here in Washington State. So a couple examples. So just electrification generally. So both for vehicles, so investments in charging infrastructure would go away, and as we all know, those are incredibly important to more people owning and driving electric vehicles. So EV charging, there would be drastic impacts to electrification of transit, statewide as well as in tribal communities. So electric school buses, electrified buses for transit systems. I also would highlight the impacts on even things like the maritime sector. So many of our ports, I think as many of you know, are really interested in pursuing electrification of the ports and are a major want to reduce their impact on air pollution by electrifying much of their shore power. And 2117 would also strip away investments there in the maritime space. And just a final one I would highlight is the one of the oldest and greatest forms of clean transportation, which is walking, biking, and rolling. So a lot of our basic investments in our bike infrastructure and in our pedestrian infrastructure would be major. It would take an enormous cut out of investments in those basic long-time priorities we have here in the state.
Thanks, Mark. One of our audience members, Nancy, also put in the chat, Clean and Prosperous Washington has a great tool that allows you to see exactly where all the CCA funding has gone. Just FYI for everybody listening. I asked Christina and Mark, so Treasurer, it's your turn. I didn't actually see this question, but what I hear often as opposing, which I think people will hear, is that capital gains tax just disincentivizes investment in Washington State, which is supposed to be quote unquote business friendly. You spoke to that a little bit, but I hear that a lot of, hey, we're making the pie bigger for everybody, that argument. And if you do this, businesses will leave, Amazon, blank, all of that, all the big companies and entrepreneurs and startups, you name what it is. What are your thoughts on that? And what would your response be?
Well, first of all, Washington State is late to the game in terms of a capital gains tax. You look at our neighbors over in Idaho, and they have a capital gains tax on everything that's higher than ours is. So that argument just doesn't hold water. The other thing I would say is that we have seen time and time again, folks have said, well, if we do this capital gains tax, the wealthy folks are going to leave or businesses are going to leave. And, there's been a lot of research that's been done, not only, looking here at Washington State, but also across the country. And that's just not something that happens. People, when they start businesses and they build businesses here, in Washington State, they move here and they live here for the same reason that all of us do, because it's a beautiful, gorgeous place to live, because we have these amazing mountains and this incredible water and these great communities and good schools, and we're close to family and friends and all of those reasons. And those are the reasons why people choose where to live. And I'll also remind folks that the capital gains tax is this is a tax that's paid for by the very, very wealthiest Washingtonians. It's actually not a tax on business. It's an excise tax on the sale of stocks and bonds when individuals sell those. And we've seen that just as a small percentage of folks will pay this tax, but the benefits will be felt across every community across the state.
Thanks, Treasurer. I think that was also a comprehensive, good answer to something that you all have thought a lot about, especially in this climate of misinformation and dramatization, I'll say, of what will happen and what our values are and what we want Washington State to be. I know you all talked about this, and this will be for all of you. What is the best way to take action and to talk about these initiatives? You covered some in your presentations, but I think if I just ask that question, if you could answer in a few sentences, I think it would be helpful for everybody.
Yeah, I think for no on I-2124, sign up as an endorser. If you are one of the folks here, you can do that by going to noon2124.org/medical endorsers, and I'll put that in the chat. I also host a show called More on 2124. If you'd like to tell your story on why you are voting no on 2124, you can certainly email me at Christina@ChristinaKeys.com. Obviously vote no on I-2124. Tell your friends and family to vote no. Also, if you have social media, any social media channels, you go to our website, which is no on 2124.org. You can find our socials, like and follow our socials, and you'll be able to see our posts and share those posts, because the greater we have an audience, the better it is for us to get the message across. So.
Treasurer?
Let me get off mute. There we go. All right. Well, I love this question, because at the end of the day, this initiative is so clear and it's such a clear choice. Do we want to give the very, very, very wealthiest folks in our state a big old tax break by taking away $2.2 billion from kids and schools and education and childcare? If we do, vote yes. If you don't, and you want to stand up for kids and families, and you want to do what's right by your communities, vote no. At the end of the day, that's the choice that it comes down to. I would echo what Christina says, which in terms of, actions to take, going on sharing on social media, signing up to support the campaign. We dropped a link in the chat for folks. We're working on a healthcare sign-on letter, really hoping to have a number of voices and folks that come to the table and lift their voices up. The other thing I will say is, to donate, whether it's $5 or $10 or $50 or $100. We're really, building some grassroots support and some grassroots campaigns, because we're going to need to make sure that we have the funds to be able to communicate with all the voters across the state. And we know that when we're able to talk to voters, when they hear what's at stake, they understand and they're with us. But we've got less than 100 days to make sure that voters really know and understand what's at stake with not only Initiative 2109, but all of these initiatives. And you can find all of that information on noon2109.org.
Um, uh, what they said, I think and specifically in our case, I think the two things, one is go to no2117.com and pledge to vote no. And that's where, as part of that, you can also sign up to volunteer. I think our grassroots strength is what is going to make the difference in this race. And so having you as part of that, you all would be incredibly valuable. And then it was said already, but I will echo it that sharing whether it's our social media content or some of the information from our website with your networks is so valuable, so impactful. So whether it's LinkedIn or an email or a text to your family text chain, whatever it might be, wherever people, your loved ones in your community is getting their information, be a surrogate for us there. And especially, as I said earlier, your voice is so powerful. And I should have mentioned this earlier several times, but WPSR has produced a really wonderful summary of a lot of the health impacts of 2117. I say wonderful in that it's very informative. The impacts themselves are very scary, but it's a great resource. And then we also on our website will have more and more resources. I saw a question also. We're also going to have a whole range of one-pagers on our website, both in terms of specific policy areas, like we talked about transportation, for example, but we will also have those by geography. So wherever you are, if you're in Clark County, if you're in Central Washington, we'll have some resources for you to be able to talk to your local community about what the impacts are locally. So thank you very much for doing that.
Thanks, Mark. Thanks, Mark, Treasurer, Christina, for doing the work on the ground and sharing all of this with us. I think this whole group is grateful to hear from you and be ready to vote no. Let's keep saying vote no on these initiatives. And as I started this event off talking about my reflection as a physician, I find ballot initiatives really interesting because compared to political candidates, it can be so specific of what are we talking about and what is the impact of it. And for capital gains tax, climate change act, we already know. Just go look at what they've committed, where the money's gone, what they've done with it. And Washington Cares Act, we've started collecting payroll taxes, and we know what the intent is, $36,000. We can be so specific about it. And as a physician, I know this is going to improve the health of my patients and my community. So I feel value driven to vote no. And this action step of my job is to talk to all my friends and colleagues, which I think we don't do enough of. So once you're convinced, your next step is to talk to others and make that change happen and support these campaigns. And with that, I will hand it off for closing to Lily and James for this event.
Yeah, hi everybody, James. I'm a staffer here at WPSR. I just want to thank you all for coming tonight. We are so glad to have you all. We are so gracious to all of our panelists. So remember, please be sure to vote no. If you're interested, you can pledge, you can get endorsements, you can volunteer. WPSR is happy to facilitate that, but you should have a number of links in the chat if you want to access any of them. So feel free to do so. Follow us on all of our social media, PSR_Washington or Washington PSR. And if you want to get involved with our climate or inequity or economic inequity and health programs, WPSR.org/climate or WPSR.org/inequity. We always need folks to join our task force and help make events like this possible. And also, we've got a pretty cool gala coming up on October 26th. So if you are interested in joining us for that, October 26th, we will be at the Mercer Island Community and Events Center talking about issues just like this. So with that, thank you very much, everybody, for being here. We appreciate all of your time. I hope you have a great rest of your day, and I hope you vote no this November. Take care.